Hi, my name is Kristen Toussaint. I'm an occupational therapist at the University of Maryland, St. Joseph Outpatient Rehabilitation. I am here to talk to you about a common concern that many people who are pregnant have regarding diastasis recti. One of the best ways to prevent this is to monitor yourself for doming along the midline of your abdomen and managing your abdominal pressure. So I'll be demonstrating ways to manage your abdominal pressure by using your deep core, otherwise known as your transverse abdominals, managing your breathing, and modifying how you're moving. So the first thing I'd like to demonstrate is how to breathe down into your belly. So pay attention to where your shoulders are and try to feel that as you breathe, you are breathing deep into your lower abdominals. So you should feel like baby is expanding in the front and in the sides, and your shoulders will stay fairly still. By breathing deep, that allows your abdominals to expand so that then on the exhale, they can better contract. You can see my abdominals rise from the bottom. So I'm not pushing down into baby, I'm gently lifting. So I'll demonstrate one more time. Baby gently rises, the lower transverse abdominals engage, and it gently pulls up. This helps to manage the pressure and evenly distribute it along the belly to avoid that pressure right there in the middle of the belly that often causes that doming. So I'm able to demonstrate the way that the abdominals look when you're not properly managing that abdominal pressure. By just leaning back, there becomes a dome right here along that midline of the belly. I wasn't properly engaging my abdominals when I went to lean. So all that pressure in my belly went right towards the middle. To better prevent this, I'm going to engage my abdominals, really pull up my lower belly. Baby comes in, spine is supported, and I get to gently lean back. This prevents that doming effect right there in the middle and helps me to better support the pressure in my belly. Most women will experience this doming when they are leaning back, when they're going to get into bed or rolling from side to side, or if they're lifting both legs at the same time. So ways to prevent this: engage your abdominals as you move, or if that doesn't do it, you modify how you're moving. So for example, when you're going to get into bed, instead of bringing your legs in and just leaning back, which may cause that doming, I would encourage you to do what's called a log roll. Go onto your side on your elbow first, gently lay down, supporting your abdominal muscles, and then get yourself comfortable. This will decrease that pressure along the linea alba. When you get back up, same thing. Try to roll forward so that you can engage your abdominal muscles. Gently push your body up, and then you're supported. That helps to better manage that pressure. If that causes pelvis or hip pain, then you can do that same movement where you bring your legs up, but instead of leaning straight down, I would encourage you to engage your abdominals, gently lower onto one elbow as you adjust your pelvis, and then lay down. You can always monitor that pressure by putting your hand right there in the middle of your belly, so that way you can feel if there's doming. And again, when you go to come up, instead of going straight up where all that pressure comes up towards that belly, you can roll to the side a little bit, engage your abdominals, and gently rise. So those were just some simple strategies for managing your abdominal pressure throughout pregnancy to help avoid any diastasis recti or abdominal doming that could cause complications after delivery. If you have any concerns regarding your abdominal performance, your diastasis recti, if you do have any, or your general pelvic health or postpartum recovery, please feel free to reach out to your providers. And if needed, you can ask for a script to be able to work with the pelvic health therapists. We are available. I'm an occupational therapist at the University of Maryland Outpatient Rehabilitation Institute.